I'm Ruth Perednik. I've worked in selective mutism as a psychologist for 30 years, running a selective mutism treatment center in Israel. I also work with clients around the world on Zoom and also in brief intensives. So we're traveling around the world and comparing the treatment of selective mutism, the attitudes, the challenges, the trends. It's so interesting and uplifting to see the trends that are global. So why is it particularly important with selective mutism to look at global trends, challenges, and approaches? I think it's particularly important because selective mutism, really the evidence-based approach, is integrative. It isn't just taking the child to a clinic and having her treated there, and then she comes out of the clinic and she's cured, but it is integrative with the significant people in her life. And it's a behavioral approach which needs to be implemented in a real life setting. So that means it's not enough to have a few therapists who understand selective mutism and understand how to treat it. And then you can, in any given city, bring your child to that practitioner. But it really is very dependent on broader awareness, on how teachers view selective mutism, on how parents, how aware they are about selective mutism, and of course, to have therapists who know how to treat selective mutism. So the cultural milieu is very, very significant. And legislation is also something that we will consider. So here are a few questions that directly impact the treatment of selective mutism, which can vary from country to country. What is the general attitude to emotional health challenges, such as selective mutism? And still in much of the world, it can be transparent because selective mutism is acting in, not acting out. And many clients have taken years to be diagnosed because they may be sitting in the back of the class, terrified and not acting out, so they may not be seen. Or what I see in my clinic weekly, if not daily, clients who have had ineffective, not evidence-based treatments. So, I think even in advanced countries where a mental health awareness and treatment is advanced, this still is happening. We still have a lot to work on. It is a relatively young disorder in that when I started off 30 years ago, it was barely heard of. So there is still a lot of work to be done, awareness and understanding. So let's break the general attitude to emotional health challenges down to the following. Firstly, what is the attitude of schools? Do they see themselves as involved in emotional health as well as the academic progress of their students? To what degree are teachers trained to spot and assist children suffering from anxiety? And in my experience, they're not that well trained and they're not that aware unless they happen to have had a previous student who had selective mutism. And I think across the board, that is something that is very important to include in teachers' training. Then we have, what are parents' attitudes to mental health challenges? Is there stigma? Is there embarrassment? How assertive do parents tend to be in getting the required help? Then we have the medical establishment. To what degree do they understand the impact of selective mutism on the child's life? Are anxiety-lowering drugs accessible when needed? How aware of comorbidities are they, particularly with selective mutism? And do they take into account the parents' attitudes? Then the legislation. What is the legislation in the country? We have IEPs, 504s, SEN support, or I will be discussing therapeutic assistance, which can be an absolute game changer. And this is really why I wanted to have this panel, because in Israel and in Argentina, there is a fabulous resource, which is called Therapeutic Assistance Inside a School. So I will be discussing that. But I do want to do a quick deep dive into the interaction of all these factors as regards parents and teachers. So how much information do parents have? And can parents advocate for their children? Can they put a foot in the door of their children's schools? from the parent side as well as the school side. Parents so often need to be assertive across borders. And as we'll see, do schools let them in? Of course, we urge schools to let them in. How much respect for parents is there, both with schools, doctors, and therapists? It is still very common practice, and I see this frequently, not to believe parents' reports in schools and also in doctors' diagnoses, where they think what you see is what there is. And that does not work with selective mutism, where the selective nature of the disorder is that the child may not speak at all in the doctor's clinic. That doesn't mean that they can't speak at home. So respecting the parents, they're the experts of their child. I would love teachers to be more trained and taught about selective mutism and other mental health issues, how to be discerning. They see the child who's sitting at the back, who isn't talking, who isn't going out to recess, who isn't playing, and they could really be the ones to notice where perhaps parents don't. I think also one of the things that we could all work on in our relations with teachers and schools is to help them see themselves as having responsibility for seeing their students' emotional well-being as well as their academic progress. Evidence-based practice is so important. I feel this so strongly for children, where they are subject to their parents' choice of a therapist, and the therapist has to be accountable that they are employing evidence-based treatments as much as possible. And there is a lot of awareness, a lot of research about what is evidence-based. It is basically behavioral and integrative. Those are the two. There is a growing recognition that specific disorders like selective mutism require targeted approaches, behavioral approaches, or cognitive behavioral approaches. I do want to focus on this one point here, because this is really what I wanted to transmit here. There's a fantastic resource in Israel and in Argentina, which is children diagnosed by a psychiatrist with social anxiety, including selective mutism, can access a government-funded basket of support inside the school setting. That could be up to 30 hours a week. In Argentina, it's a therapeutic assistant, which is usually psychology students. And this is a really fabulous resource under two conditions. There are two prerequisites. One is that the key worker or the therapeutic assistant or the shadow is chosen to be somebody who can connect with children, who is warm, but is intelligent and can follow a program. And the second is that they receive the right kind of guidance. It isn't intuitive. It isn't always that they will learn about sliding in, exposure techniques. And I advocate that they start at home. They have 2 to 4 sessions of sliding in at home. And then they go into the school setting even before the beginning of the school year. Then they do sliding in, exposure, enabling the child to talk to more and more people. I do want to say, really, my final point here is that together with this, there's a growing recognition that the integrative approach, combining therapeutic agents of change who are parents with their own interventions, teachers with their own interventions, guided by therapists, together with this shadow, and that is a very, very powerful bundle of support that goes a long way to helping children overcome selective mutism.